Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast. My name is Terry Fletcher. Can you believe it is actually May already? Me either. It's hard to remember what day it is because they're all running together at this point. But the weather is getting warmer. I do see more and more people outside. The states are slowly reopening, which that is an awesome thing to hear. So there is a light at the end of this proverbial tunnel. So everybody think positive. We're slowly getting back to what we know as normal. So hopefully it won't take too long. And just so you know, I see some things on the news, and I know we all do, and we see things on social media. Make sure you research it before you either retweet it, repost it, send it to anybody, like it, or anything like that. Just an example this morning. So I have family that live up in Oregon, and there was something on Twitter that said that Oregon, the state, that the governor decided to push their opening to July, and that isn't the case. She's pushing the opening publicly, apparently, to July because she wants more state funding, because states are getting funding for COVID based on how late they're staying closed, which to me, that's just so suspect legally. But she already told everybody locally, because it was on their local TV stations, because my brother lives up there, both of my brothers do, and they're opening most of the rural areas in 15 days. So what was actually posted on a social media was not accurate for the state. So just make sure you're aware of that. We have so many inaccuracies here in California where I'm located that it's hard to know what's true. So I have to do major research on everything that I hear. So just want to make sure that you're aware of that. Now, remember last week how I said I am not going to have May be anything about telehealth or COVID related topics? Well, I tried, everybody, and I really did, but CMS published another FAQ update, not only on April 28th last week, but again on April 30th. Then they canceled what they call their office hours call, which is their biweekly call, and that was on April 30th. I'm sure they meant to do that. They said, oh no, it's because of COVID information. Oh, it wasn't. It was because they knew all hell was going to break loose based on how they worded some of their language. And I noticed that a lot of people that post information on telehealth, COVID, whatever, they post it based on clickbait. And I know you've heard me say that before, because I also podcast and write for a Pittsburgh Steelers site, Steel City Underground. I see that word a lot, the clickbait word, because everybody wants to be the first to be liked, the first to be thinking they're in the know. And that happens with any kind of news. That's why you hear fake news CNN all the time, because they post a lot of things that isn't accurate. It's just a knee-jerk reaction. And it's clickbait. It basically gives you a headline that says this is what it is when it actually isn't. And so they put out some things that were, I don't want to say misrepresented, but let's just say if you only read the headline, you might have thought some things were covered that really weren't. And I want to bring that to your attention because it's crazy what everybody read into a headline versus actually reading the document. And again, it's crazy because there was 36 pages. They called it the Medicare COVID emergency declaration blanket waivers for healthcare providers. And they keep calling this as the 1135 waiver. And then they go into the IFC, which is the interim final rule with comment period. And then they go back and date things so that they know when it's updated. But here's what they posted, and I just want to make sure you're aware of that. They posted something that said audio-only telehealth for certain services, and that was the headline. And so everybody went, guess what? Now you can bill audio-only office visits. No, that's not what they said. So if you actually clicked on that and read the waiver, it said, pursuant to authority granted under the CARES Act, CMS is waiving the requirements of section, now this is going to be a little technical, 1834 M1 of the Act and 42 CFR 410.78A3 for use of interactive telecommunication systems to furnish telehealth services to the extent they require use of video technology for certain services. Nowhere does that say for E&M as far as visit codes. This waiver allows the use of, now listen to this, this waiver allows the use of audio-only equipment to furnish services described by the codes for audio-only telephone evaluation and management services and behavioral health counseling and education service. And then they give a list, see designated codes, and that list has grown to 288 codes that they're allowing audio-only or just under the telehealth umbrella. And it says, unless provided otherwise, other services included on the Medicare telehealth service list must be furnished using, at a minimum, audio and visual equipment permitting two-way, real-time, interactive communication between the patient and the distant site physician or practitioner. Basically, they're saying, look, we've told you over and over again, audio-only codes are part of telephone codes. Two-way audio-visual, we will allow you to have the visit codes, which are the office visits, new and established patient, and hospital codes. Now, what people read is that they saw the words, or I should say the phrase, evaluation and management services, and they ran with it without looking at the word prior to it that said telephone. So if you have your CPT book and you go back and look after the webinar, look at page 39, and the very left column talks about non-face-to-face services. It says telephone services, and then there is a blurb there that kind of gives you a paragraph of the definition of what you have to provide to be able to bill for it. Then it gives you three codes, 99441 to 99443, all time-based. Talks about also a global period of 7 days before, 24 hours after. That's all inclusive. But then if you look right above where it says non-face-to-face, right at the title page of CPT, page 39, it says evaluation and management non-face-to-face services. So yes, these services fall under the evaluation and management chapter, but it doesn't mean now that audio-only services for Medicare are covered as an office visit. Please do not make that mistake. Now, second, what I want you to refer you to is that list I told you about. So you can find it on some of my links on my website. If you're a Coding Corner client and membership, you know I send you out this list in a spreadsheet form. But what they did is the list of Medicare telehealth services is basically an Excel spreadsheet, and it's 5 columns, and the fourth column says, can audio only interaction meet the requirements? And it'll either say yes or it'll be left blank. And if you pull it down and look at codes 99201 to 99215, actually going all into the hospital, let's just expand that, 99201 to it goes on and on to home visits, domiciliary visits, ER visits, observation visits, anything, prolonged care, anything that has to do with an actual established patient or new patient visit code. It doesn't have a yes in that column. Where it has a yes in the column, and this is what was added, is when you get into certain behavioral situations. So behavioral assessments, psych services, adapt behavior services. They have added some of those services as, yes, health behavioral intervention services, psychiatric and neuropsych services and testing. What else here is on? Some medical nutritional services if it's a patient who's diabetes. They have here prolonged exam psychiatric. That is a yes for audio only. But you have to look at this list. Advanced care planning is on this list where you can do that as far as on the phone only. Diabetic management services. Let me think here more. Depression screening, behavioral counseling, obesity screening. All those can be done over the telephone only where you don't have to have that video portion. But you need to really look at this list. Otherwise, you're going to have a really hard time when audits start coming out, and they will start coming. I've been kind of conversing on different platforms with a colleague, or I should say a connection of mine, that he is a retired HHS investigator, senior investigator, and all he talks about is, everybody's going to have a really hard time when it comes to audits that are going to happen, because as soon as these happen, we're going to have some really suspect situations. And the reason is because, they opened up some services for optometrists, for example. Now, I get pink eye as far as the be audio-visual. But when you look at some of these services, or really any specialty that requires a hands-on treatment, can it adequately be facilitated in, when it's not an audio-visual or in person? And can this, what's the line that's going to be drawn here between an actual service and a worthless service? We're trying not to discount or demean the office visit code by saying it can just be a quick phone call with a patient. So what Medicare actually did, which this is a good thing, they actually decided to at least get closer to cost or reimbursement parity. And what that means is that in line with some of the E&M services that are visit codes with telephone codes. So the 99441 to 99443 now, it basically now will be subject to reimbursement along the lines of 99212, 213, and 214. So based on time, so the 99441, which is a 5 to 10 minute visit, that's going to be reimbursed closer to a 99212, and so forth. So that's why time has to be documented to be able to even bill a visit code. So just keep that in mind, that try not to clickbait. It drives me crazy when I see practices do that, because then that becomes a problem. I want you to be able to bill and capture anything you possibly can, because I know revenues are down, but I want you to do it legally, compliantly, and within the letter of the rules and the law. Otherwise, it will come back to bite you in the end, and we don't want that to happen. Another thing I wanted to bring to your attention, I have had a couple of practices ask me about social distancing to reopen their practice. And there's a lot of practices out there that need to reopen regardless of what the rules are, because they have patients where their quality of life or their condition is going to get worse if they're not seen personally. So they have said either their waiting room is not big enough, or they just don't have a way to separate patients enough. So what I recommended, and actually this came from one of the societies I belong to, the NSCHBC, and we were talking about this, and I thought this was a great idea. And that is, have you ever seen those restaurant beepers? They light and they buzz, and they're, square, and they're pretty big. But patients or physicians can buy those and bring them in, and they have a pretty good radius, almost a quarter mile. So they can buy those, they can set them up, hand one to a patient when they come in to check in, and then they have their mask on when they come in, and then they can go back and wait in their car or outside or wherever they're comfortable, and then you just buzz them in when they're ready to be seen. And so a couple of practices that I recommended this to, they started this practice, and they said it's been excellent, where their patients basically are excited to do that. And they're not very expensive. They're about $10 each. You can get them on Amazon or anywhere. But again, try that. And it just really helps with that social distancing, but getting patients in a safe environment where they also feel comfortable. I think the one thing that's going to come out of all of this is we're going to have an unfortunate amount of shut-ins and people with agoraphobia and just not wanting to go out anymore and just being in fear of it, because that's what this hysteria has created. I don't know if you've looked at the CDC website as of late, but as of May 1st, they said that there were only 30,000 deaths in the United States. Now, again, I'm not minimizing that isn't a lot, but if you look last year on how many deaths we had just with the flu, we were over 100,000. Just with car accidents, with anything else, it's been more than this, and we've shut down the world for something that isn't, I don't want to say isn't as bad, because then I'll get cards and letters, but just isn't as fearful or as tragic, and it's not the plague as everybody is saying. Remember, the CDC also has on their website, and that's why I'm referring to them, that this is 98.7% recoverable. I mean, I had it and I've recovered in 2.5 weeks. It wasn't fun, but believe me, it was not pretty. But I was at the end of January. I'm recovered now, as I was recovered in middle of February. But they're making it sound like if you get it, you're absolutely going to have a demise situation, and that's not the case. So not with everybody. People with compromised immune systems, asthmatics, COPD, anybody over 65, again, compromised health, then yes, there is a danger there, no question. But just be aware that it's just do some due diligence on this. The media is basically scaring you into what it really isn't. So just be careful with that. And I want you to do your own research, because I'm giving you my professional opinion based on what the Centers for Disease Control, the World Health Organization, is posting and what they're saying publicly, and also what I'm seeing from an ICD-10 situation. So my information is coming directly from them. It's not just my opinion, it's my professional opinion based on that authoritative reference. So I just want you to be clear on that. Okay, so when we get into usually after I talk about this stuff, I like to do a coding question. But today, and actually my sponsor, I talked to them about this, there was something that came up in modern healthcare. And I always try to read through my material before I get on a podcast. But there's something coming up that I actually wanted to substitute my coding question today, because I did give you codes already when it talks about the telehealth. But looking at some things that are happening in relationship to some fraudulent attacks. So right now we have documented evidence of 137 COVID-related phishing attacks, and then also 9,116 attacks from March 1st to March 23rd. And what these are scams, phony cures, solicitation for investments, or requests for donations to fake charities. There's been also blackmail attempts. And so just also be aware that there's another telemarketing thing out there that is calling patients and telling them that they are a telehealth physician, and to give them their information to check on them, that your physician gave them permission to do that. And so it's amazing what's happening out there. We knew the scams were coming, but it just makes me sad that we actually even have to talk about this. That's why when I mentioned before about telehealth, and for any of you that have taken my PowerPoint educational piece, you'll notice I have a slide on there that says no soliciting patients. All of this telemedicine has to be patient initiated. So make sure you tell your patients that if anybody calls you saying, we want you to get in, or we want to see you over the phone, or anything like that, make sure if it's not your practice that they call to check. Otherwise, they could be being scammed for telehealth services, which they would end up with an out-of-pocket. And they might even be scammed with somebody saying, don't worry, we won't charge you your deductible and copay, and then that becomes a real problem. Not only because the patient's being scammed out of their insurance money, but also because what if they give fake medical information over the phone, which I'm told they are. So really warn your patient about this potential. Okay, so one of the things I also wanted to bring up was something about telehealth and telemedicine. And although the words sound similar and some payers and organizations may define each slightly different, I just want you to be aware of these general definition differences. So telehealth is any health service provided through telecommunication. Any telemedicine is any clinical digital service provided through telecommunication. So there is a difference. One is considered two-way interactive real-time services, telehealth, and the other one is a clinical digital service like portals, like videos that you're just taking a still video and sending it to the doctor, or a picture or a photo, or just a phone call. So just know some of those things, and know that can be a little bit different. You don't want to give some information that isn't accurate. I know it's tough because that tele prefix is being used on so much information, but hopefully you're listening in every week. If you are a Coding Corner member, you're getting all the information that I have every week because I send it out. But I also, in saying that, I wanted to welcome some of our new Coding Corner members as well. All of you, actually. We've had a flood of practices sign up these last 2 weeks, especially last week. And so you'll be the first to get new information, free webinar options, and some alerts. So not to mention that if you ever have a question, whether it be coding, billing, reimbursement, anything, you can shoot me an email with your membership account number and get that responded to within 24 hours. I'm actually usually quicker than that, so just know that is an option for everybody. So go to my website if you're still interested in that. Our coding question and legal insight was brought to you today by Advanced MD, cloud software for independent medical practices that delivers industry-leading patient outcomes and financial performances. Also a leader in telemedicine modules, advancedmd.com. Make sure if you're interested in getting any kind of platform for telemedicine that you contact me. Advanced MD and their technological advances are awesome, and they interface with any kind of system. And also I have a relationship with them which will give you some discounts, so just let me know. So today I want to end with something that I thought was very cool from one of my listeners from Victoria, Australia. This is Claire C. And Claire posted something on LinkedIn today that I really wanted to share. I just thought it was awesome. And she just basically was talking about things that we've learned. And Claire is a clinical coder, clinical coding auditor, and a clinical documentation improvement specialist, again in Deep Den, Victoria, Australia. So here is what Claire posted to LinkedIn today, and I just loved it. We are more than we ever thought we could be. I am sure you are too. COVID-19 has forced us into things we never thought we would do or adjust to. I've adjusted recently celebrating my birthday, and things were a little bit different. My day consisted of Pilates, puzzles, walking the dog, a quiet family dinner, Zoom drinks, and starting a huge painting. My most ambitious project ever. I wonder would I have started the painting without the current restrictions? Although it was not what I had imagined, it was exactly what I wanted. Has COVID brought what you wanted to the forefront? Brought out something new that you would never thought you were capable of? Thank you, Claire, for that. I just thought that was such a great post because myself as well, one of the things that I get trapped in, and I talk about this on my Business Collective podcast, is that work for me is actually therapeutic as well as it kind of gives me some mind space. I'm actually recording this podcast on a Sunday in my office because it's quiet. My daughter's driving me crazy, let's face it, and at home. And so I'm trying to get some space to have some quiet time. And I love podcasting. So for me, this is almost kind of like a day off, for me, because I try to take Sundays off. But what's interesting is I just really appreciated what she said, because what I struggle with is downtime. I have all these puzzles I'd like to do. I love doing puzzles, but I feel like if I open it, then I'm not going to get laundry done or house cleaning done. And even though I have housekeepers that come every couple of weeks, I still have, obviously chores around the house, but there's interesting things that you just feel like you're not really being productive if you take some downtime to sit there with a book that's not related to work. And I just really appreciated what she said and getting out her creative side. So if you had a chance to do that, or if you're having a chance to do that, let me know. Shoot me a DM. Let me know what your creative side is. I love that people embrace some of the positive, personal things that I send out there. And it's just really fun to hear some of the feedback. I love my Instagram direct messages and Twitter direct messages I get from a lot of you. So try to start something new. Embrace your downtime, because let's face it, when we get back to normalcy, you're going to be just as busy as ever, and you're going to want to say, wait, what happened to when I was at home and I got to do these things? So just some time to really kind of get into some things that you never thought you would do. And I love the painting idea, something I've always wanted to do. I'm actually writing right now a true crime podcast, and I'm writing 2 novels. So I'm trying anyway. So one is work related of another book, but the other one isn't. And working on that Bun Life podcast with my daughter, which is just a lot of fun cracking up. Last night we had kind of a moment where, do you ever clean out your refrigerator and you open it and you're like, what is smelling in there? I keep a clean refrigerator. It smells terrible. Well, Summer is on this new diet where she is only, and she's my 25-year-old adult daughter, where she's only eating protein and fruits and vegetables. No starch, no white flour, no bread, no nothing. No tortillas, no chips. I could keep going. So she's embraced cauliflower rice. Okay, that stuff to me is just disgusting, but okay, whatever. Well, what you don't know, unless you do know, is that it smells terrible. And if you make it and then put it in a Tupperware, but don't close the lid tight, it smells like a dead rat just died in your refrigerator. And so I could not shake that smell yesterday. I came and cleaned out the entire refrigerator, even cleaned out the freezer, could not find it, getting ready to call my handyman saying, I'm going to have you pull out the freezer and pull out the refrigerator. Maybe something crawled behind it. I don't know. You never know. Well, then all of a sudden last night, after she had a couple glasses of wine, she goes in the refrigerator because I'm like, Summer, what is that? It's disgusting. And she goes, oh, shoot, I forgot to close the lid on my cauliflower. Here, smell this. Tell me if this is it. It almost knocked me over. It was so gross. But I posted a video of that conversation on my Instagram and my Facebook account, and we were cracking up. So just some things like that. If you have anything like that, things that are just funny to you, things that happen, let me know, because right now we could all use just a little bit of a sense of humor and some comic relief. So anyway, with that, I'm going to end today. I hope everyone makes it a great week and a great day. And hey, thank you for listening to the Codecast podcast. Make it a great day, everybody.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.